Hello, I'm Jonathan Herland, interventional pain management physician. I'm here today with my assistant Slim to talk about facet joint pain. Facet joints are tiny little joints that we all have throughout our spine, slightly left and slightly right. They are present through the lower back in here. They're called lumbar. They're also present through the mid-spine in this area, called the thoracic spine. And furthermore, they're present here in the neck, and it's called the cervical spine. With time and gravity, other people call it aging, joints can begin to degenerate and become inflamed, and then they can be a source of pain. Additionally, if someone has had prior surgery on any part of the spine, the facet joints that are immediately above or below the surgical site will experience accelerated degeneration and are frequently sources of pain in those locations. Typically, facet pain is worse standing than sitting, and on an examination, facet pain will get worse if the patient is bent backwards like that, and worse if twisted. In the thoracic spine, it's similar, and in the neck as well, it's similar. So these maneuvers are typically used in an examination in order to ascertain if pain is really coming from those joints. One of the tricky aspects of diagnosing facet joint pain is that sometimes it can be mistaken for pain in other locations. In the neck, for example, sometimes pain from the facet joints can actually be felt in the shoulder. In the low back, sometimes facet joint pain can be felt out here in the hip or down lower in the sacrum. So these are things that need to be considered when making a diagnosis of facet joint pain. Treatment of facet joints is actually a bit more straightforward than the diagnosis. What's done is, under X-ray guidance, the patient, and with the patient participating, we pick out one or two or several joints that are in the location where the patient guides us, and we inject a small amount of medication on either side of the joint in order to block the tiny little nerves that supply the joint. Then remove the needles, wait 5 minutes, and then we'll stand that patient up and ask the patient to do the same thing that hurt during the initial examination. That is, bend backwards and twist. And if the patient says, "Oh, this is fantastic, my pain is blocked," then we have a pretty good diagnosis. If we were to do this technique once or twice and find that the pain relief is only temporary, then the next step would be a technique called radiofrequency denervation, in which these same tiny little nerves can be cauterized. Radiofrequency denervation will be the subject of another video. Thank you for watching.